Ceann Comhairle, it's good to be back, and particularly good to be back in the aftermath of the successful campaign of Catherine Connolly, and can I congratulate her in her position as our new president. It's also good to be back on the day that a socialist gets elected in New York. Signs of hope and portents of the future. I hope. Certainly not. We might learn a few lessons from it, though. Can I also just thank colleagues across the House for kind words today, but also messages during, before, after my treatment, and also to thousands of members of the public who sent very, very kind messages to me. They were really very, very heartening and very helpful. My biggest debt of gratitude is to the fantastic people who work in our health services, and particularly in the cancer services. In my case, St Luke's and the Ioneer Hospital, but there are similar people providing cancer services right across the country. And they asked me to raise particular issues about the need to properly resource and support cancer services in this country. And it's important to say that everybody has a stake in that happening. 50%, I didn't know this, but 50% of people will have an encounter with cancer during their lives. 44,000 people this year will get a cancer diagnosis. The Irish Cancer Society made a whole series of requests pre-budget. It's still not clear about whether any of those have been met to fully fund and resource the National Cancer Strategy. But there's a very particular issue for me and for the people who provided me with the care in St Luke's in the area of radiation oncology machines. They're called linear accelerators. They basically have given me my life back, and the staff, the infrastructure and so on. And 50% of those very high figures who get a cancer diagnosis each year will need these machines. But fairly incredibly, 35% of those machines, which are supposed to be replaced every 10 years, are now 15 to 17 years old. 40% will need to be replaced in the next 5 years. And this means that there's a lot of discomfort, stress for patients, for staff who need this life-saving treatment. And what the people who work in radiation oncology are asking for, and they've asked repeatedly for this, is for a national radiotherapy replacement programme that is where there's centralised oversight and procurement, and where there's ring-fenced funding going forward, multi-annual funding, so they don't have to come each year with a begging bowl for money to provide this absolutely vital machinery to save lives.
Thank you, Deputy Minister.
Thank you, Deputy Boyd Barrett, and again just to welcome you back and to say I welcome the fact that you've raised issues relating to cancer services and the National Cancer Strategy. I think it's important just to take a step back and look at the progress that we've made over many years since the National Cancer Strategy was reduced. Over 65% of patients living 5 years after a cancer diagnosis, compared to 43% in the 90s. And I think a lot of the reforms which were introduced in previous years, difficult reforms by ministers at the time around centralisation of particular services, of hubs, has yielded much greater outcomes for citizens across our country. And like you, I want to commend all of the workers across our hospital system who provide that daily care and compassion and support for people as they go through their treatment journey. What we've tried to do in recent years is to build and resource a public health system which responds to the needs from a workforce perspective. And that's why in the last 5 years we've nearly 30,000 additional healthcare workers in terms of whole-time equivalents working in our public health system to support and rapidly respond to diagnoses or particular incidents as they arrive from a cancer and a lot of other health perspectives. So next year we'll have an allocation of over 27 billion in terms of the overall allocation to the Department of Health. And what we're doing, and you asked specifically about radiation oncology, which I'll respond to, in my negotiations and engagement with Minister Carol McNeill over the next 5 years from a capital perspective. We've over €9 billion of capital in our health system over the next 5 years, a record level. And what Minister Carol McNeill is doing now is developing a sectoral investment plan, working with the HSE on the capital needs in our system. Some of that will relate to radiation oncology or respective treatment interventions around replacing existing equipment. Others would relate to obviously new beds and building bed capacity across our system. But we, as a government, have prioritised funding our health system, funding more workers in our health system, more beds, and also funding the technological improvements, which I think will yield greater improvements in our life expectancy. And that's why we're taking digital health seriously, and why we're prioritising that from a capital perspective over the next 5 years. So I'll ask Minister Carol McNeill to respond to in time to your specific question and take a note of it in terms of the work that's happening on the capital plans for the next 5 years. But we have resourced and significantly reformed successive governments our health system in terms of cancer treatment, and we're seeing the positive outputs from that, and due to the great work of the people that you mentioned.
Thank you, Minister. Deputy Boyd Barrett.
The people who professionals in this area say the following in the context of the budget. Radiotherapy services are operating significantly below capacity due to under-resourcing. They go on, our healthcare staff do everything they can to minimise the impacts and care for patients. However, it is simply not possible to provide optimal care in these conditions. 16 of 24 working days last month were affected by unscheduled downtime because machines are breaking down because they are too old, putting stress on patients and staff. 23 million a year is been spent on outsourcing to the private sector because of machines breaking down, not being replaced, and the lack of a national replacement programme where, as I said, doctors who should be providing from the services and the care to patients are instead, in their own words, looking to, minister, governments, departments, begging for the money, the resources and so on to replace the machines they need to provide the care to save lives. So you need to respond to the specific request to have a national programme for the replacement of these machines and the staff and the infrastructure necessary to deliver it.
Thanks, Deputy. And look, I share with you the focus on ensuring that our health infrastructure in terms of radiation oncology machines, or indeed building better bed capacity across our health system, is achieved in the next 5 years. And that's the work that we're doing around the sectoral investment plan with the HSE to ensure that we replace the equipment that's required, that we build additional capacity, and also to ensure that we are funding a public health system now, which should become less reliant on the private health system over the next series of years in terms of outsourcing and some of what you've referenced there. But I just want to commend the enormous work and leadership of many people in our health system who've transformed outcomes. And it's important when we talk about the National Cancer Strategy, it's a strategy that has worked. It's delivering improved outcomes, and if you look at the data over 2 to 3 decades, we've had a transformation and improvement in that over the last number of years. But I will ask Minister Carol McNeill to respond to your specific question around radiation oncology. And I believe there is a significant scope over the next 5 years through the investment we've put aside in the National Development Plan to have a significant replacement programme for a lot of the health equipment which is required.
Thank you, Minister.